We'll talk briefly about the treatment of Past disease. The most commonly used medications are the bisphosphonates, calcitonin, mithromycin, and gallium nitrate. They don't really work very well. This is not a very good disease to have. These are really more for symptomatic relief. They don't alter the course of the disease very much. It's mainly for symptomatic relief, unfortunately. So since I think we still have some time, Wing, I'm going to show an interesting case that came to our attention about 2 months ago at that hospital. This is a very young soldier. He's about 25 years old, and he came to us from the southeastern United States, from different states, where in the community there, the doctor described some findings on X-ray they were confused about. So they sent the patient to us. This is the lateral view of the cervical spine. You can see the C4 vertebral body looks different from the other vertebral bodies. The cortex a little bit thick, especially superior inferior end plates. So the spinous process also looks a little unusual, maybe a little thickened cortex. Puzzling. So a CT scan was obtained, and you can see that C4 vertebral body, there is indeed thickening of the cortex, right? On the sagittal reconstruction, cortical thickening. Now, I told you earlier, when you see cortical thickening, you start thinking maybe Paz disease. But the problem is this patient is 25 years old, and that doesn't really make sense. This is a disease we see in old people. It's not a disease we see in young people. So something doesn't quite make sense. I mean, we'll see what happens here. On this axial image, there is this, on the right side, the lamina here seems to be losing some cortex. That's not right. For Paz disease, certainly when there's no sarcoma, we should not be losing cortex. So this is very puzzling. Why is the cortex going over here? So there's some expansion of bone and some kind of maybe coarse intravehicular, but this doesn't look as characteristic as the kind of patterns we saw earlier in our different slides. An MRI was obtained on the sagittal T1 weighted sequence. Again, the C4 has this kind of a thickened looking end plates. But most importantly, on post-contrast, post-gadolinium T1 weighted fast X-ray sequence, there's extensive soft tissue mass that is adjacent, running both north and south of that C4 vertebral body next to the neuroforamina. This is very strange for Paz disease. This doesn't make sense anymore. In fact, when you see soft tissue mass that's sort of lining, going along longitudinally here, we'd be thinking lymphoma. So this was undergone a biopsy. The lesion was biopsied both at the soft tissue mass portion and the medullary cavity, and this was indeed lymphoma. So this is a case where initially on the CT scan here and here, you might mistake it for Paz disease, but it's not exactly characteristic. There's not so much trabecular coarsening. You just see thickened cortex. So not everything that looks like Paz might be Paz. You have to think more deeply about it. So this was an interesting case that came to me.